So you chipped your tooth, but what do? Well, it depends. I'll first talk about what's the most common type of fracture that I see in my practice, which is when you break a tooth and it's about a third to half of the tooth missing. You kind of look like you're on a hockey team, but you're not. And so what I have these patients describe to me is, are you in pain? Can you see the yellow portion of the tooth kind of on the inside of it? Or is it just the white portion of the tooth that you can see? But when there's some sensitivity to hot and cold, that's sort of the classic sign that we need to go ahead and do some bonding, make sure that the nerve is not affected, make sure that the tooth is still in the right position. And you can even save, if you can find the portion of the tooth that chipped off, because we can try to bond that back together in some scenarios for a really, really aesthetic look. Some things to follow after you see me and after we've bonded things together and splinted your teeth so that they can stay in a good position is we want to make sure that the tooth stays vital, stays alive. So for a good 2 to 3 month, up to about 6 month window, we check to see if the tooth starts to look brown or gray. If it starts to change color from the usual whiteness that we see, that means that the tooth is starting to die. What do we do in that situation? We do a root canal for that patient, for that particular tooth, and then we can do internal bleaching to lift that color from the gray or brown back to its original white color. A crown finishes it off nicely so that unless you told someone, nobody knows you ever had a crack. The best case scenario is when you have the tiniest chip on a tooth where you almost look in the mirror and you have to get real close and squint your eyes and stand on one toe, and then you're trying to see if there's a chip. I have a few of those myself. I think it's the mark of a good childhood. But for those particular types of chips, most of the time we'll just smooth it out, make it look good, but bonding to that actually does not work very well. It's such a tiny chip that if you try to bond something to it, just the natural function of you chewing and talking can knock it right off. So the best scenario for those very, very tiny chips is to have a dentist smooth it out, make it look aesthetic, balance everything out, and you're good to go. Now let's switch to like worst case scenario. Let's say you really fall, take a nosedive, riding a bike or something like that. That's one example of something I've seen in my practice. And your tooth is off to the side like this, and it's quite painful. That's a situation where you'll go to the emergency room, they'll get the oral surgery team, they'll right the tooth, but they'll also check to make sure that there's no fracture on any of the bones of your face. They may even get plastic surgery involved to make sure that everything looks aesthetic once you're all put back together again. And then from there, we may consider, again, splinting the teeth to hold them in place and check to see if they change color, or we may go straight to doing an implant at that particular site and then placing a crown, so that the goal, of course, is so you look completely normal, like nothing ever happened.